To get started for our committee meeting for the protection of children. Before we get started, would someone care to ask a blessing over our meeting?
Father, I ask that you would guide us tonight, that we would have your wisdom, that you would help us to understand the needs of our community and how we can help and be an asset that honors you, honors our constituents, and thank you for this time together. Amen.
There's not really, much on the agenda per se. I handed out something that I asked a question last month about the things that you see are the issues that we as a committee can focus our attentions and energies on. And I understand that this is still a very large topic to get ourselves around. But I think that in trying to narrow our focus to a couple ideas is important. And also to not only to figure out what it is we're wanting to really talk about and suggest perhaps to the county commission, but also what our timeline of that looks like. Now, I think I spoke early on about, I don't think it's anybody's understanding or idea that they want to be sitting here a year and a half from now. Love y'all, y'all are fine folks, but I'm sure all of us have other things that we can be doing. So just try to find a realistic timeline of what that looks like. I had asked a question. I want to pass out some of the responses I've received from folks, but also I had asked my staff, just and for folks who are involved specifically in the business of children, much like y'all, what do they believe would be things that we can consider? I think that one of the things you're seeing, and it's a pattern that moves through, that we're not all far apart in what it is we think is important. And if that's the case at varying points around the county, I think that we could probably come closer to a consensus pretty quick. Now, it doesn't have to be 3, it doesn't have to be 2, it doesn't have to be 1. If there are some areas that we believe that might be worthwhile to pursue for the protection of kids, then we can do really, I think, whatever we want to do. There are the request from the commission is sort of wide open. One thing that we talk about a lot through here, and I know that I've mentioned before, is about mental health. Everybody here has talked about mental health. and it's such a large topic and subject that I think it's always very worthwhile mentioning. I think it may be, and I know the commission seems to believe it's beyond sort of what we can do. But I still believe it's certainly worth talking about and telling them this is something, regardless of whether it's a huge topic or not, it's still something that crosses all of our minds as important for our kids. So I guess I'm going to just open it up for a minute and let y'all, if there's things that you want to discuss here. Alan's taking our minutes for tonight's meeting, so if there's things that we want to talk about or narrow down or what have you, I'm certainly more than happy to. Nobody speaking once, so that's important.
I just attended a few trainings with Jason Foundation, so it probably was in the forefront of our mind whenever I submitted my 3. The way that those statistics are gathered, there is the clear cases of suicide, but then the accidental cases of suicide are sometimes not in their percentages. So that is struggling. And firearms and firearm storage is a big play in all of their cases. I also serve on the fatality review team. We're seeing a huge increase in teen suicide in our county. So that's just how I got to my degree.
And just for sake of folks who are not in this is the child fatality review team.
It is.
And what does that consist of, and who's sponsors this and how often do you meet?
So we meet quarterly. We review every fatality, 17 and under, in our county. And Becca's actually on it as well. And law enforcement's there to actually speak to the facts of the case. But the main thing about the entire meeting and the policy and the statute that it comes from is about prevention and getting back to the root of, was this preventable? Was this an accident? Was this just health related? We even have to review children with cancer, but we review them all. But we have had quite a few suicide cases.
Sumner County.
And we meet quarterly at the health department with a doctor from Vanderbilt.
And so you have both the natural causes of death as well as
Correct. All.
criminal causes of death.
Correct.
All kinds of deaths.
All 17 and younger.
What's the number usually in Sumner County? Quarter, say, or a year, annual?
Every quarter we review anywhere, and Becca's been on it longer than I have. We review anywhere between 8 and 12 every quarter. So you can do that times 4.
About 50 a year then.
50 a year, which seems low. But what you have to remember is some of these cases are held up due to autopsy and held up due to criminal. They're held up for other reasons. They don't sometimes get before us until a death certificate or something like that. Like there are always different, situations and cases that doesn't get reviewed. The cases do overlap sometimes in child protective services with Becca's line of work. They will even overlap into our work where the cases, were investigated by child protective services. Sometimes there are cases that can really go through and, all of us are like, how did this get through the cracks?
What's the population of Sumner County, roughly?
Gosh, I don't know anymore.
It sounds awfully low.
It does sound low.
50 to under 18 in
Uh,
the whole county.
Yeah, and the thing is, though, you have to remember, we're reviewing cases far after they actually occurred. So like our review in December could actually be cases that occurred in February. It takes that long to get to our review. Just due to criminal, death certificate, autopsy, all those things.
Are these deaths of children that were, like children that passed in Sumner County or children that resided in Sumner County, like at the time of their death?
Good question. My understanding is residents of Sumner County, because some of the deaths do occur in Davidson County at hospitals and stuff like that.
Or so on the contrary, if we had a child that was, a resident of Davidson County, that
It would be
passed at a party here, that would be a Davidson issue.
my understanding. Becca thinks otherwise. That's fine.
What do you do with the information?
It really is about was it preventable?
Okay.
And then in hearing everyone at the table talk about preventable deaths is really what, in making notes of what steps could have been done to prevent that. So we go as far as to talk about firearm storage. We go as far as to talk about prescription drug storage. Like we go into great detail, and the director of our group has to write that report.
And send it to them.
And they send it to probably the main director over mental health and our board. I can get this answer for you.
No,
I'm pretty
I just wonder where it goes to be
Yeah.
able to be implemented.
Yeah, it's a statute that every county every district. So we are 18 districts, and so every district has one that's not.
So we're, Sumner County being the 18th judicial district, we're a one-county jurisdiction. So our friends over in Lebanon, for example, that's a multi-county jurisdiction. So they'll do Wilson, Smith, Trousdale, Macon. But yeah, you get the general idea. It's a judicial district for that. And I think that some of that goes in one of the deals we talked about is access to social media or the exploitation and sex abuse. One of the things that we covered at my judicial conference this year, we had a seminar about sexual exploitation, particularly as we think of it as sextortion. So you have kids who are, you know, it's pictures, and then you've got folks worldwide who are becoming involved in this blackmail of children who are taking pictures, and they're either being forced into, you know, either you're going to send me money or I'm going to send these photographs out. And also with the rise of AI, you're seeing these kind of created photographs regardless. And one of the things that we talked about was a kid who had never had anything prior, and wound up, and he was not a Sumner County child, but he wound up being caught up in this sextortion situation. He wound up committing suicide over it because they asked for money, and he paid the initial money, then they asked for more money. And he winds up committing suicide over it. They found out later what it was all about. So, to me, like I put down on mine, threats of mass violence. This is a rising problem. I know that, Mr. Pepper, particularly you're in the school business, and you would have received the letter that was sent out from that was co-signed by myself, Dr. Langford, by our sheriff, and by our district attorney, to address issues of threats of mass violence in school. We're seeing these cases pick up. We've done, my docket on Monday had 3 or 4. We're averaging seeing 3, 4, 5 cases, new cases a week popping up. And the age of the kids is getting younger. We're not talking about 17-year-olds and 16-year-olds. I did a 9-year-old, 10-year-old this week. Turn around, we'll do a 13-year-old. And as Logan, who has represented some of these kids, can tell you, it's a problem. I mean, we issued this release hoping that might explain what it is we're going to do, and it still continued. I mean, we're picking up steam. It's a constant detention hearing over some child who has either threatened to do something, and then the other day we had one who had lied on somebody else. She had gone to her father and told them that this kid had made threats at school about going to shoot people. She told her dad. Dad called the police. Police got involved, called school. They get involved, and as they go through the process of the threat assessment, which is required. And as they move through it, they realize that there's nothing here, and they go back to the initial source, and she admits that she lied about it, and she didn't because she didn't like the kid. And so these are the kinds of things that we're beginning to see more and more. And there is a mental health component to many of these cases. It's not just I don't like school or whatever. There is a mental health. Many of these kids don't know what else to do. You've got this, again, we're talking about the sextortion and exploitation there. And I think that, again, mental health, and as you can tell, one of the issues that keeps being raised is, by many people, Becca included, is about just lack of resources. We've got such income disparities in this county depending upon where you are, and it's just a lack of resources that a lot of folks. You know, we had a kid in court not terribly long ago, I think on the threat of mass violence. And as I get into it and start asking questions, it becomes obvious that the parents, they don't know what to do. They don't know who to go to. You know, we're asking, well, have you talked to so-and-so? No, I didn't know we could do that. So many, whether it's even school-based stuff. They just, you know, I know, Mr. Duffer, you've had that kind of thing undoubtedly before. Folks come to you and with sort of a clueless, and I'm not trying to make fun of them, but just a clueless.
We spend a good part of our time educating parents. Not that, you know, they're dumb people. They're not.
Right.
They're just ignorant of the resources that are available. And we say to parents, we don't have all the answers, but we know a lot of people, and we have a lot of resources, and together we can find those answers. So you're exactly right. The other thing we have found with threats of mass violence, not always, but children live in echo chambers, and hear things at home and they repeat those things that they feel are solutions, and they're not. So part of our job is not only to educate students that, hey, we have a new policy and we have a new stance. We have to educate parents. And when the parents and the students are working in conjunction, then you start to see change take place.
Well, you had mentioned in your school culture, and that's sort of what I took out of that as well, in addition to, parental care and personal safety, it is building, because when we released that letter, I mean, it's a conversation that my wife and I had with our son. I mean, my son is 9, but it's the kind of thing you want to tell them. So we told our son, you can't even make any remote jokes about this. Everything is hypersensitive. And I'm not saying that's a bad thing, but in this day and age, we're all very cognizant of the notion that we don't want to be a national news story here in Sumner County over something that is preventable, something that at least, if nothing else, we can all look at ourselves in the mirror and go, we've done everything we can do. So,
is there a sense of what's behind the threats in terms, is it for attention, is it to, what? Have you seen a thread through it all?
Rick, what would you say that you're seeing?
Students are not as tolerant as they once were. They don't tolerate things. So they deal with emotions. And sometimes, as an out for those emotions, they'll say anything. It's like a scream. It has no meaning, it has no purpose, and it has no real intent. So sometimes kids will say things just because they're a bundle of emotions trying to let those things out, and they say the wrong things. It's, you can't say, I'm going to bring a gun and I'm going to blow your head off. I'm going to do this. I'm going to do that. And sometimes kids, they don't mean it. They don't mean it. But we're not in a position to decide, is the kid serious or are they not? Because when they speak it, then it becomes more real for us. So I think the folks that have taken a stance on this to say, we're not even going to discuss this, we're not going to talk about it. If you are experiencing things, that there are resources for you to sit down and talk about those things, but students are not going to be subjected to fear of being shot, being cut, being bombed, and those kinds of things. So again, it's just a continuous conversation that we have with students in large groups, in small groups, and in many cases one-on-one. And it's just, students are dealing with so many situations that they don't know how to cope with.
I was just gonna say, by the time they get to me, which by the time I get to these kids, they've already been charged, they're in court, they've needed an attorney. And I will say, I probably 95% of the kids that I get that are charged with threats of mass destruction, it's come from, they were being picked on, somebody said something they didn't like. I know the last one I had was a 10-year-old, and I mean, it came down to he was sitting at a table with a bunch of kids. He and a girl were going back and forth, kind of really tossing insults back and forth. Well, apparently she tossed out something that he felt like crossed the line, and that was, well, I've got a gun at home, I'll bring it and shoot you. And so, and of course, his parents didn't understand why this was so serious in the court system, because, they're like, well, we don't even have guns at home. This wasn't a real threat, and it's become a big conversation I have with parents of, this is a zero tolerance issue at this point. Like, it doesn't matter whether the threat was valid or not, whether they could actually carry it to fruition. When we get to the point where your kid's threatening to bring gun, knife, bomb, whatever to school, that's a zero tolerance issue, and they're not dealing with it. We're no longer at the point of looking and going, well, could he actually do it or not? So, but I would say 95% of the kids that I get appointed to that have these threats of mass destruction charges, it's come from not necessarily a continuous bullying issue, but even just a one-off issue where they're, somebody picking on the bus, they were told they couldn't sit with somebody at lunch, little issues, and they blow it. It could blow way out of proportion.
Sporadic sometimes. Judge Howard said something there a moment ago. Said he and his wife had a conversation with their child. Same with our grandchildren. My 2 sons, they had conversation with their children, and then when my wife is transporting him to school in the morning, they ride with her to school, they hear it again, and then how many times do you have to tell a child something before it's, I don't know, but I bet all of us have had conversation with our children, our grandchildren, in an attempt to educate them and put them on the right path. Unfortunately, some of our students have just a small number of people that have those conversations with them and reinforce all of those good things that they need to hear. And many times that's what we're doing.
And I think that along the lines of that is that we have to listen to what they say. You know, it's not just I'm gonna bring a gun and shoot somebody or shoot at the school or whatever. I think that we have a unique position to be able to get down into some of the situations and go, what is this about? We've got to listen. We can't. And I think that Rick is exactly correct. We can talk to them and we can repeat it to them, but at some point in line, we've got to come back and we've got to listen. Because, I mean, you know, we were all kids once. You know, when we did dumb stuff as kids, we're feeling lots of emotions when you're growing up and you don't sometimes know what to do. I mean, I think you all see that at Bat Center. I mean, you're seeing these things where kids don't know what to do. So giving them an opportunity to have somebody who cares enough to sit down and go, tell me what's going on.
Which goes back to that resourcing. I just walked through a threat of mass violence with a kid, 5th grader in my own church, except for you a few weeks ago, and mom lives in government housing. What do I do? I don't know what to, back to that big question. And so I sent him to the Bab Center, but they couldn't pay, so the church paid for that first visit. You know, so we're trying to resource. There's only one person on staff there that can handle kids that young. And so, like, they had to wait almost a month to get in, but it goes back to that resourcing. And otherwise, that kid isn't going to get much help through this. Like, they're not going to know how to address the bullying, because that was his issue. So how do we help? How does the commission perhaps provide more of those resources to help kids once they've done it, but then also the preventative is what we've got to do.
So currently, this is the most powerful way to get attention to.
Oh yeah, he got a lot of it after this.
Yeah.
It's immediate.
Yeah, it's immediate. It is hardcore, and you know,
Stirs up the whole.
sure, and even bad attention is attention.
It shuts down the school day.
Yeah.
So what?
It shuts down the school day. And so I think that it's that.
Well, power.
Yeah, there's that as well.
But you mentioned something a second ago, you know, we're talking about you have 30 days. To us, 30 days flies by. You know, I was looking at the clock and, you know, the calendar and going, it's already the 19th of November. But to a kid, 30 days is a lifetime. I mean, they're staring down and going, when is things going to happen? Particularly a kid in crisis.
I mean, essentially he's grounded. So
Yeah.
think about what's your time, how long it went in your head the time you were grounded. And so he's grounded until he probably can get to the counseling and move, you know, through some of these things. And so it feels like forever.
What's a typical sentence, not sentence, but what's your typical?
What we do at juvenile court, so it depends upon the age of the child in question. But let's say that we have someone who is over the age of 13. And unless the case is dismissed, regardless of whether they're found guilty of the charge, whether they're given what's called judicial diversion, which allows them to, it's a conditional plea, which can ultimately be dismissed against them later, they're guaranteed probation. So we have, at juvenile court, we have somebody immediately that they report to, that is, can call the school and make sure that therapy is followed up on. So we do probation. Depending upon the age of the child as well, we may make a referral to our mental health court. We have a juvenile mental health court in Sumner County. So we may have our director, Ms. Harper, become involved in that case. And some of that is just simply resources, and for younger kids in particular, she takes a much more hands-on role, just to make sure that moms and dads and kids and everybody's hearing one another. I'm not, it's a strange thing because the easy answer is to go hard. But when you start trying to figure out the whys of these things, you're not going to start ordering a lot of public service work. You want to make sure this kid is getting what they need. One of the things under the statute, because the threat of mass violence statute was amended this year, so it is now a felony. One of the things that's under the statute now and as of last year, when it was still a misdemeanor, is that the court can order a psychological evaluation on the child, which is paid for by the state of Tennessee. Sounds great, right? But there's only like 1 or 2 providers who do the assessment for these kids. And let's say Logan's got a client, because she's shaking her head yes. She's got a client, she goes, Judge, we're going to have a psych assessment done on this kid. Okay.
We're going to set it out 6 months.
Yeah.
And then it's probably going to get reset again because the assessment's done.
Yeah, you're
We
guaranteed.
don't have the results.
Yeah, you're guaranteed 2-3 months down the road. Guaranteed. Easy. Which means under the Juvenile Justice Reform Act of 2018, I can put Logan's client on probation for a maximum of 6 months unless I have a hearing at the time of prior to that 6 months to determine that that probation should be extended for a period not to exceed an additional 6 months. And for example, that would be a reason why. Judge, my client's evaluation's not done yet. Okay, then we need to extend this to ensure that the client's evaluation is done so that probation plan can get into effect. So services can get into effect. Even if you've got somebody who's like, they're going to counseling right now, okay, that's great. But we want to give them time for that counseling process to work. Because again, when we're dealing with wait lists, it may be a while, there's no tree to shake and the counselors come falling out of it.
Can these charges be expunged?
Yes. One of the few things in Tennessee that cannot be expunged, besides like murder, is threats of terrorism.
But this can?
This can.
I would think this is substantially influenced in effect going to college. And trying to get into a college, getting into a dorm.
Because
It's on your record.
There's also a thing that we don't, and I've never have figured it out what exactly shows up and what doesn't.
Yeah.
When colleges run background checks, sometimes they show up and sometimes they don't, and I never have been able to figure out what makes sense.
And they're very clear, they can get direct access to the records.
Yeah, and we're being asked constantly now by the Tennessee Bureau of Investigation about for firearm purchases. So let's say that Amy's daughter is going to wants to purchase a firearm after she turns 18 years old. The TBI now, and this is a point of real contention around the state amongst the judicial, especially juvenile judges. The TBI will contact local clerk's offices saying, does she have a prior record? What is that record?
Including juvenile?
Yeah. And that's the big issue. One of my colleagues is like, I tell them that I'm only going to do it if we have a hearing within 3 days. And then when they don't show up, I dismiss the request and I keep on moving. But I'm like, it's kind of hard to swallow that sometimes when you're going, this kid got charged with aggravated arson.
We're all thinking of kids in our heads
Yeah.
right now, thinking, if that kid got a firearm legally, how scary that would be. That's one of the things that I wanted to ask. These kids that you're working with, is there a specific age where there's more of this, or is it just spread all over?
It's spread all over now. For the longest time, we were seeing it more middle school, late middle school, high school.
Okay.
We're beginning to see I don't say it's a shift, but we're beginning to see things spreading more into the elementary school age.
When we do cases for younger kids, now, they still get a probation officer. We're still very much up in their business. And now they, however, as a younger kid under the age of 13, they're automatically sent over to our mental health, one of our divisions of mental health court, which is a family systems part, which means that we're monitoring a lot more. Our problem is a manpower problem because we're seeing the numbers increasing, but we're having a harder time.
You don't have people to work with them.
Do all the parents know about the no tolerance policy?
It's been sent out,
Is it
so.
have they been well educated, the parents?
Really?
I'm sure.
We make every attempt to educate parents, and we tell the students. We not only tell the students, when I say we tell them, we literally take time out of our day to speak this policy to them and say, if a threat is made, it will cost you greatly. It could mean expulsion from school, being charged by the SRO, and all of those things. And I'll give you, for instance, we're common sense people, but I sit on the disciplinary committee for Sumner County schools, and two different circumstances came to us. One young man said, my dad hunts and I have access to a gun. Okay, well, the girl heard that. That was his comment. She said he was offering that as an innuendo, suggesting that I can get a gun and I may shoot you. Now, that's a stretch, but she made that statement. Another young man told a friend, I'm going to bring a gun and I'm going to F this place up. The friend said, when are you going to do it? He said, first block, and I'm starting in the library. The kid said, I'm in the library first block. And he said, I will let you know so that you can leave. He had a plan. It was a step-by-step plan. And when you start saying those things and putting step by step in place, that requires a lot of premeditation, a lot of thought. So there's a level of seriousness there that we have to look at and we have to deal with. He was charged. He was dealt with the school system. The other person, not so much, because we didn't see that as a well-orchestrated, premeditated plan.
Have you had any hunting gun scenarios come to you? I would think that would be very, very sweet. But there is a different one, if you need to go to a disciplinary board, or it actually goes and is charged criminal.
I haven't seen, I don't think I've seen the hunting scenario.
Yeah.
That's an interesting one though, because I could easily see
That's a good example.
that pop up.
Mm-hmm.
But I have seen plenty of
The young man with the hunting scenario was never charged by the SRO.
Okay, good.
but I could see the other scenario, and we have gotten pretty close.
Is the SRO the screening mechanism too? Is the SRO determined?
Correct assessment.
Yeah. So I guess for purposes, so Rick, could you just describe so a threat is made. What is it that at your school, a threat is made, what is the next step?
When a student makes a threat, we deal with them as a school system, and Sumner County Sheriff's Department deals with them independent from the school system. Though we're working together, we act independent of one another. He can charge, he cannot charge. That's up to him, the training he's had, based upon the evidence that he sees. He may choose not to charge the student, but I can charge the student with the school system and say, though it may have not reached the level of criminal, it still is a behavior that we're not going to tolerate within our school system, and we've got to take a stance on it. So it just depends, again, on the circumstances, and oftentimes he will charge, we will deal with disciplinary hearing, either alternative school or in some cases expulsion.
Yeah, and if it's a charge, so the SRO will make a probable cause determination. If they think that there is enough there, they will charge, which then triggers the threat assessment that's done, which also triggers somebody from the sheriff's department is going to that kid's house, and they're looking.
Yes.
So they're going in, and it's
it's not just, I'm gonna take your word for it, they're going in and they're searching, because they want to determine how legitimate and credible is this. If it's the case of the guy who goes, I'm starting in the library, and oh yeah, by the way, I'm gonna tell you, so that way you're not there, which is very Columbine, frankly, that's what happened with them. But they're gonna toss that load. They're gonna go in there and they're gonna be looking for weapons. They're gonna be looking, if dad has guns, where are those guns? Does the child have access to those guns? How credible is that threat moving along the way? And if they find that there's a credible threat, this kid is going to detention. And they're going to be charged criminally. They're going to appear, we have a very fast turnaround system for this now. So they're going to appear for a detention hearing within 72 hours of the time of their arrest. And then they're going to appear in court within 10 days of the date of the charge, so that we can start addressing issues.
Parents will not be arrested, though.
Parents will not be arrested, and I suppose if the parent is aiding and abetting in the situation, I can certainly see that. But no, just on the overall, I mean, and I've seen more parents who are just seemingly shocked than anything else, and they want their kid to be taken care of. If there's a problem, they want to do something. But like we go back, many just don't know what to do. And if you're not having a lot of experience with that, it is a large question mark of what am I supposed to do? Where do I go next?
And so you're telling me, or telling us, that one of the biggest problems that we have in this county is we don't have enough resources, counselors, things like that to help the kids once the problem has been identified.
I believe so. Yes, ma'am. Would you?
And the resources that we do have, the parents don't know how to access them.
It's up to them to access it.
I mean, most of the time, once it gets to the court system, we can require that kids go for these assessments and things, but ultimately the parents, even if they see an issue before it gets to that point, they, especially, I think people more out in the Westmoreland, Portland, more rural areas, I just think they don't know where to go.
And so many have to come this way.
Living in government housing, working in manufacturing jobs, the family that I've been working with is like, go to Hendersonville?
Yeah.
45 minutes at 1 o'clock on Tuesday?
That's like a vacation.
It's impossible.
Yeah.
I can't take points to take my kid to counseling in the middle of Tuesday. So, that's just legit. It's just no way around it for these kids.
Yeah. And you add in insurance. If you got I hate to say it, if you got private pay insurance,
and then pay $150 for an hour for your kid, to see no change that day. It's tough. It's a heck of a sell.
Yeah, I agree.
The state does pay for testing.
To testing.
If you can get access, if you can get an appointment.
If you can, now the good thing with the psych assessment for threat, we will set that up.
Okay.
My office actually sets that up. But it's one of those deals later when we go, my assistant comes in and goes, I've called them 4 times, I've emailed them, nobody's called me back yet. And then you're going, and then like Logan said, I'm looking at the clock going, well, their next review with me is in 2 months. And I know that we're not going to have that assessment done and the report generated and back to me and to her and to the DA before we can do anything. Right.
What's the current, this may be for Rick, what is the prevention model that we have here in the county for, I guess maybe going to the schools, some kind of training, be prevention for these things. Do we even have anything like that? For example, there's a lady in our church, and she's very much a part of Rescue One. They deal with sex trafficking in Nashville. They take all these people in. But they have put together a tremendous training where they go in high-risk areas, and it's a great presentation. And, they deal more with I guess, and it's one of the things we had on here, was sexual abuse exploitation. And so they're on the front end saying, talking to teenage girls. If you go online, here's the people who are out to get you. Here's the things. So I didn't know if in the county we had sort of something, I guess we're trying to recommend something as a county what is the prevention of this before we get to this? 'Cause you're getting this part of it, so that's what I'm trying to figure out.
Registration at every school, like new student registration, it started from day
Like,
one.
is there like a training they go through and say, look, here you go?
Probably gonna be added to that, very first day.
I'm speaking for our school, and each school has the autonomy and the opportunity to educate students and/or parents to the greatest extent possible. We bring in outside resources, and we talk about sex trafficking, we talk about teen pregnancy, we talk about all manner of things to prevent students from heading down primrose path, going the wrong direction, and those kinds of things. We have taken 4 days, and grade by grade by grade by grade, we have hit various topics, one of which being threats of mass violence and what will happen in the event. So we seek every opportunity to educate our students, but we also try to educate parents, and we have student night, parent night, ask parents to come in and get these topics. But he's spot on. If you've got parents, many of which working 2 jobs, asking them to break away from a job when they are living paycheck to paycheck, they don't take off because they can't take off. They see working as a greater need than coming in and talking with the child's parents. I'll give you a for instance. Young man in class, struggling academically. He's at my school right now. I called a lady with Sumner County Schools, Carol Scott. I said, hey, Carol, can you come up? Can you test his vision? She said, sure. And she said, Mr. Duffer, he can't see. I said, we suspected that. So she said, but I tested him when he was in middle school and told Dad, and Dad never got him glasses. So we connected with a resource. They said, we'll pay for the glasses. Just parent has got to bring him in. He's a juvenile. Parent brings him in. We're going to get him the glasses for free. So I called the dad, and he said, I'll get him there. So I checked on that date. They never showed. I called the dad, and I said, look, Dad, I hate to be difficult, but what you're doing to your child is neglect, and I'm going to seek resources to help your child, and it may be adverse to you if you don't get him to the doctor and get these glasses. He's wearing glasses now, but we have to go to those lengths in order to help children when you don't have parents that cooperate.
That's that more that breakdown family system thing.
Yeah, and they're not bad people. Yeah. They're not bad people, and it's all in how you approach them sometimes, but it's a tough sell.
Yeah, and so much in our system in the juvenile court is reactive.
Right, that's what I was asking on the preventive side. What's our model for prevention?
Yeah, unfortunately, for my court, we don't roam the countryside looking for stuff to do. So much, unless you hit me, we're not going to do anything. So I think that notion of prevention is important, and it's trying to find those resources in the communities and try to get them out and talking, because otherwise you, like Rick said, sometimes you strong arm this situation just to avoid other issues. But
it's a web, and if folks on the outside of that web do an effective job, he never sees those people.
Yeah,
and that's a good thing.
Yes,
it's a real good thing. If they get through us, through our filters, and get to him, then there's been a breakdown somewhere. Maybe with the kid, maybe with the parent, maybe with schools, maybe with law enforcement. I don't know, but how do we get them before they get there?
Well, that's the question I was asking is, do we? And I don't know, you would know, if there was a county initiative for that. I guess that's what we're really getting at here is the county. If there was a county initiative that produced a training, do you even think that would be possible or effective?
We have counselors.
Day 2 or 3. I was talking about like if the Sumner County said, all our schools are going to go through this. Because I know you were saying a lot of the schools have that autonomy to do their own thing. I just didn't know if that would be a possible. I'm just trying to think of how do you prevent this from the beginning.
I think anything is possible.
Yeah. Well, I keep thinking back to what that training that And I went through that with them. I said, I want to see your training. What does it look like? Show it to me. And they walked me through it, and I said, this is really good. I never would have thought of this. And like one of the things they threw out, just an example, was most of the child sex predators are online after 9 o'clock. Because the parents then are either gone to bed or their kids on the phone and nobody's watching them. And they said they know this. And I was like, I had no idea. I didn't know that. And so there was some very, unique things they were pointing out. And so that's just an example of one issue. You're talking about the sexual exploitation, but then you're talking about some other issues. I didn't know, the same as the county, how do you prevent some of these things? I didn't know if that was even what the county said. Hey, we're going to put together a really good training. You can't force people to watch it, but you can put it in schools, I guess.
Do they still have the care teams and all that in the elementary and middle schools? That's, that's something that you could almost use with, especially middle school and elementary, even with the court, with the kids being put in care teams. I mean, it's been a long time since but we had teachers that were trained, and we would have 5 or 6 care teams where the kids were placed by the teachers usually that needed some kind of help. But, I mean...
And I think the teachers are a great resource because these are the ones, they see these kids all the time. They after a while, they can read them. I mean, my son's not 9 years old, hasn't been in trouble, but I mean, talking to his teachers, they figure them out, and they can tell you have a kid who's struggling in some respect. And the beautiful thing is when these teachers are responding in a way to try to help these kids find a better situation, and to stress the parents who are, like Rick said, many of them are working and they're struggling themselves, and that also goes into, we've got kids struggling more often than not. You got parents who are struggling.
You still have parent-teacher conference. What percentage of the parents actually come to parent-teacher conference?
As you move from primary, elementary, middle to high school, it drops off exponentially as you move up. Simply because kids, it's like there's a breakdown in the relationship as they get older. And other people take the place as a parent. If you've got a 16-year-old kid and their parent who is college educated tells them something with specific scientific medical truths, and their buddy who is 16-year-old tells them something, they'll choose their buddy 99 times out of 100. I mean,
you're right. I mean, one of my big jokes, and maybe an appropriate stat, but it's like, where did you learn about sex? On the street from people who knew just about as much about it as I did,
So,
And
a follow-up question. So, are the teachers allowed to provide resources to the parents in the parent-teacher conference?
Sure.
Okay. Sometimes I've heard, rumors like teachers are not allowed to make referrals. They're not allowed to tell parents, here are the 3 safe places you can go, 1, 2, 3. You can pick one of those 3. Can they actually give resources and specifically?
They can't make diagnoses. They can't do certain things, but they can say.
If they parents need help though, and say, where can I go to get this, and this? Can the teacher actually say, well, I know these 3 resources that are available?
They can do that.
They can tell.
And if you choose to reach out to these individuals, they can shed more light on this than I can, because I'm not qualified to diagnose or those kinds of things. But they can certainly point them in another direction.
Okay.
I have a question.
yes, sir.
Good.
Let's think about the training. And you might have the answer to this. My son's at HHS. They all have iPads. Is that countywide?
Yes.
Yeah, that's for high school.
High school, middle school? As I was thinking through this, I was just sitting there thinking about, that'd be a great avenue to use training, or, you could even have, I'm just throwing out ideas, I'm just shotgunning now. But I was just thinking, they've all got that iPad. They can't do anything they want to, but if you had something on there, are you experiencing whatever, and you got a link to that thing.
There are so many things on that iPad I did not realize, and now I should senior, but so, bathroom passes are through the iPad. So
I didn't know that.
the bathroom, it actually is an app on there. My child has a 504 that she can actually have a little bit more range to leave when she needs to. And so I think hers has a star or something, and so she can be in the hallway if she's going somewhere or something like that, to see the school nurse or something. But there's bathroom passes, so there could be a training added to the iPad.
Or links to resources, I mean.
That's what I was gonna say.
Yeah.
I wonder if there's, which I don't know.
I think there is a reporting. I think there is a reporting button for an anonymous
Okay.
referrals. It is on that iPad.
I would think
Threats and things like that. Is on that.
I was curious. I wonder if there's a way to I don't know, create an app is the way to say it, but to compile a list and add these resources almost into an app, put it on the kid's iPad automatically. So if they go into an app and they're struggling with food insecurity, or their parents are having transportation issues, or all of these things, that those resources are already in this app.
We have QR codes all over the school on posters for that very thing, but you're exactly right. Doing that as a push out electronically on the apps would make it very easy.
Parents aren't gonna come to the thing.
211.
And it's hard to get a gathering people together, but everything is on that right there.
I think
And on
it's
the
a really good
iPad.
idea.
It's already paid for by the county.
Yeah, I think it's a really good idea.
I think we can shut this thing down and move on now.
Add something.
That's a shotgun.
Lively conversation tonight, folks, that's awesome. So, all right, I think that we're moving in a direction, I think that something that we can suggest. So, do we want to make this kind of thing our primary focus of saying, being able to report to the commission saying this is something that we believe might be very worthwhile to pursue? That would require a partnership perhaps with the school board, but I think that we might be in a good position to have that as well. With particularly Rick's push on here, I think would be very helpful. I certainly don't mind talking to the school board as well, saying these are things I think that we may have some very positive impact in a system that's already in place.
Yeah, and they have to look at it.
Yeah.
Every now and then, Uncle's on his guy's iPad, his work is right there, everything is there. He's looking at it every night.
Okay. All right.
Parents can access it too. Right.
Yeah. All right. So I think this is a very good idea. I like it because we are dealing with protection, and it gives, much like all the QR codes and stuff, it gives that thing that this kid is already looking at and goes, I got a problem. And we just educate them and educate the parents. These are things that are right here, right now, accessible, and you don't have to feel bad because.
And you don't have to go talk to somebody that you wouldn't want to go talk to.
Well, ultimately, it's something that these QR codes could be sent home to elementary parents or to the preschool parents and say, I know your kid doesn't have an iPad, but you have a phone, just scan this and add this app to your resources.
We have a system now that will send out in batch form. It will go out in a mass call, a mass email, and we can actually push those things out as messages based on contact information that we have, even down at the elementary level.
Like,
So,
yeah, my son goes to Union,
right,
and so I get messages from his teacher, from Mr. Taylor. If something's happening in the school, good, bad, or ugly, I get these push messages that come in, and like our letter that went out about threats of mass violence, it hit my phone before I even knew that it was, and I find it. It hit my phone before I even knew that it was ready to publish. And so, because I got it, I'm like, oh, look at what I just did.
Do you have a sense of what percentage of your parents have access to a computer at all times?
A large percentage. They may not have a desktop, they have iPhones, and they have access to that. I'm just sitting here, and we're brainstorming. I mean, you got a great idea, I'm going to tell you, but we could create an app ourselves called Help. And under that, we could have a menu that offers prevention, that offers drug
The
addiction,
211
that
is
offers.
already out there. 211 is the resource code for anybody and everybody. You can text it, you can also call it, and it will be.
It is a variety of, okay.
The 211 needs to be added to our iPad.
Yeah.
That would be the resource linkage
Sumner
part of
County
it.
just came out with a new resource guide too, with everything in it. So that,
But it would be housing, food, and it would include everything.
Yeah. It's
And then 988, which would be the suicide line.
Yeah.
So like the suicide line, I mean, there's just a lot of other things
And I
that
think-
to include child safety.
And I think that part of it, I had a case today where I preached this one. As parents, we want to think that we know what to do and how that we're parenting our children. But for some folks, probably, it's putting away pride to get to the greater good of your child. So, I have to put down my selfishness and my pride to make sure my son is taken care of. And that's a hard thing to do, to admit that you may not know what to do. You may have to admit that you're wrong. But I think that telling folks it's okay to push this app and ask for help because you got folks who want to help you. And you're not diminished as a parent or as a person, as a mom or a dad. You're not diminished. Point of fact, you should be emboldened because the hardest thing to do is to ask for help. So I think you've got a great idea.
Well, I'm sitting here thinking about this, and in church, you try to, it's the same issue. It's like you can have something in the bulletin, you can have it here and here and here, and you feel like, well, I have no idea what's going on.
Yeah.
So I've got an app.
That's just
And
your
if you're, yes, it's mine, it's just mine, I get it, nobody else.
nobody reads.
And so people are like, I don't know what's going on, I'm like, give me your phone. Usually the older people, I say, I'm 54, but I'm like, give me your phone. I'm gonna download this app right here, and I'm gonna go to your notifications, and I'm gonna set notifications. And now, when we send out a notification, guess what? It's gonna pop up on your phone. You didn't have to do anything. Let's make this real easy for you.
Make it,
Short's better.
giving them the stuff and making it easy for them.
And if I had a Sumner County app or whatever, here's my high school app, and I had put a notification, I have the reminder on there already,
Yeah.
so I get things already. But, I mean, that's where everything is, it's right there on my phone, and my apps do the work, so I don't have to do it.
All right. I think that's great. I think we're gonna get in a good place. So, I guess a couple things. I think that this is something, and that we need to sort of hone in on. If we want to make this our prime thing to do, that's certainly fine with me, and just keep it very simple. And then, number one, do we want to meet next month? It's going to be December, Christmas is coming. The 17th would be our next available date for a meeting. Or do we want to pass for another month until January? And then also, what do y'all think of our timeline as far as getting our idea down onto paper and submitting our report to the commission?
I would say, first of all, December is busy for everyone.
Yeah.
We should skip that.
Okay.
That's
Is that agreeable?
Here.
All right. So with that, then, that passes unanimously. We will skip the December meeting, and we will meet again in January. Is the same schedule moving? I understand month to month can be difficult, but the same general idea on the Tuesday night. 21st.
Where I think yesterday.
And then that'll get us past the holiday season.
Because we already have this idea and we have almost 8 weeks to work and think through it, should someone reach out to the school board and talk to maybe the technology director about the capabilities that they have of the iPads, or what is protected, what is locked down? Like, should we go ahead and flush that out, or should we?
I don't think that we should wait. I think it might as well, if they look at us and go, there's no way, then we pivot and do
I don't mind volunteering for that. I feel like I know who that person is.
Chris Brown?
Yes, and then one person was already there, but she just took a job for Apple.
Yes.
Because she learned so much. She moved on, but I can definitely, but you probably know exactly who to talk to too. I just wonder what can we add to it? What did it come with and what can you
Do they take them home with them? Okay.
After the summer, they do not have them in the
Chris
summer.
could certainly tell you that. I guess the question is, 211, it's already an app that is built that gives a network of resources to students,
To individuals. It's not student-based, it's just.
to people.
Yeah.
But it is user-friendly to where parents, students, everyone.
It's also a phone number and a text message. Like it is.
But if we click on it, does it go to multiple resources with multiple contacts?
I've been on it.
You have to do the research.
Yeah, you gotta,
Okay.
I have a whole 3% to do this. Let's see if I can get it. But 201 helpline.
Okay.
And it even looks like it's color coded with, housing, clothing, right, like that. It's the big push from our United Way is using 211 as well, and so we could have had
Is it an
actually.
app? Did you say?
It is an app, it's also a text message, also a phone number you can just call.
Yeah, I can tell you, we need to talk to Chris, but I can tell you that can be done with no problem. Yeah.
The question will always be, how locked down is the app? Is the app going to take them anywhere inappropriate, I don't know.
So if that's the avenue, I guess then our job would be to figure out of these right here, what is it we're wanting to hone in
I
on?
think we can think of it as child safety as a whole, though.
Yeah.
Think about 988 being added, which is the suicide hotline. Like,
Right,
we can think
right.
about child safety as a whole, and the iPad DVD,
Yeah, that's the vehicle to transmit
It's the
the,
vehicle.
get a prevention method and whatever else, but so I guess now we're tasked with saying, okay, what is it we wanna, I guess it was the county we wanna hone in on.
Beginning of the school year, how to use it.
But it's giving referrals in
South Dakota.
Yeah, so here in Gallatin, just say Gallatin.
It says Gallatin at the top, but then it's all
Oh, no.
Maryland and South Dakota.
Right.
So maybe we need to come up with an app that doesn't exist without.
Yeah. Or is there any other
There's
resource?
Hendersonville, North Carolina.
I actually think United Way has a resource linkage on their website, so, like you said, we just gotta bring new resources too, so,
They're bringing the research.
yeah.
Could we even make it a part of our study to where we actually create with people who we know, with contacts, phone numbers, those kinds of things, based on input that we get, what is our greatest need? Is it student hunger? Is it student sex trafficking?
I have a list that I actually sent to Amy and Becca a while ago that I think it was put together by the Shalom Zone and somebody else. I know Becca and Amy were gonna look over it to see if they had any resources that were not on there, because I think it was a few years old. So I think if we can get an updated list, we can certainly send it out to everybody else to see if there's anything else.
If you wanna email it to me, then I'll have my assistant email everybody. Okay, that way you got my email, you know where it's coming from. So I'll email it out.
And that way, because I know everybody here is from a different part of the community, so if there's other even kind of smaller nonprofits or resources that may not even be in that list, that we can add those and compile them all into one kind of map.
I can see a marketing nightmare, people who want to get on the list, or they want clients.
Well, one thing that I have, and I hate to say it, but one thing that I have seen in my time in court is you'll have people who get fired up and they want to get on that list and they want to provide services, and then they're gone.
Yeah.
We'll, every now and then for court, we'll have groups show up and they're going to come in and they're going to meet with my staff and they're going to tell us all the great things they're going to be able to do, and they hang around for 3 or 4 months and then they're gone again. And then you know, because they've lost funding or they've lost people, and then the next group drifts in with the tide.
Who's going to keep updating this resource?
All right, it is after 7. I think probably right now is as good as the time to end. So we're going to plan for, we'll skip our month's meeting for December. We'll come back and reconvene in January. That gives us, like Amy said, about 8 weeks to look at what it is we're doing. And I think that one thing to consider is particularly if we're asking the county to allocate resources, i.e. money, we need to factor in budget time. And the budget will be closed, will need to be submitted into February. So I hate to put it this way, but we may want to consider the 21st, if nothing else, even if we're guiding it for a couple of months until the next budget cycle concludes. I think that by the 21st, we need to at least start talking about money.
And there may be some funding
Oh,
out there
excellent.
that I'll check out.
All right. All right, we have a motion to adjourn. All right, second. All right, thank y'all very much.
Merry Christmas to all.
Merry Christmas.